يا زيني هم النسيم والليل بواب ظلامه له قمرة في سماء.
يا زيني هب النسيم والليل بواب ظلامه له قمرة في سماء.
يا زيني هب النسيم والليل.
The doctor is explain everything right, alhamdulillah. But I want to explain about epilepsy problems. The epilepsy problems are the two kind in the world. One from the jinn, one from the brain problems. How can they know this from the jinn and or from the problem in the brain? If anyone has epilepsy, if you see him, is any water come from the mouth or the hand like twitching like this, okay, and the eyes become white, it has problem in the brain, not from the jinn. The three points now. The water comes from the mouth, the eyes become white, and the hand like this. This is not from the jinn. If you have the epilepsy from the jinn, he's sitting straight and open the eyes. Not become white, not the water come from the mouth. This is very important. And you talk about the depression problem. Depression problem is happening in this country. I've spoken of this country. Is for the women. The problem of women. Most women like has problem homesick, and having this depression coming after delivery baby. This something happen inside the woman. Hormones change, and she become depressions. It's called in English Portsmouth. I think like this problems. This happen most women after 3 months. The problem happen in her. And the man, the most problem for the depression using the drugs. 90 people% in the hospital in UK from the drugs problems, and a few people has a problem from the family. And this one about the woman and man. And some other point, the people he's become Muslim. Most people become like he's become Muslim or he's like not practicing Islam and become like okay now. He say as a jinn with me? No, he's not jinn with him because he stopped something haram before. He uses drugs, and when he's stopping, the things come in his brain, and you think the problem inside him, the jinn, not in the Islam. No, you have the problems. Most people, English and the Asian people, when he become Muslim, he thinks the jinn with him. No, he's not jinn with him. The problem is before he's using drugs. After when he stopped the drugs, the problem came in the brain on him. This is our situation. And just give the brother Isa talking. I want to see something. Can I give this example? Yes. I talk about ta'weed, brother. Is most people say the Quran, the ta'weed by Quran, but subhanAllah is very, very. Look at this one picture. This is the Quran, and the people put in the neck. He told him this in the Quran. The bad pictures and the ugly, not name of Allah subhanahu wa ta'ala. This is he told him put your neck, you become okay. The doctor he speak right. The people has no iman. He wants something like very like open the switch, he become okay. He can't. The people has mental problems, has the people like mad people, sometimes. This one example. All the ta'weez, not ask Allah subhanahu wa ta'ala. All the ta'weez ask Ali, ask Fatima, ask Hussein. Not ask Allah subhanahu wa ta'ala. All the ta'weez, if you look this one, is put in like cross. It's very, you can't reading this one. All the ta'weez inside the cross and timetables, no numbers, no Quran inside. And some people in London bought it this toadstone for the people, £200 each. This one for the court. If you go to the court, you become free. This one for marriage. Yes, the people believe this problem. The people bought it. He bring to me. He said, I bought it from the people in London. Stone. And this one, look. This from Pakistan. Ta'weed, he said, Naqsh. All numbers. You can't understand the number. The number is bad name of Allah subhanahu wa ta'ala. If you put bad name of Allah subhanahu wa ta'ala, the people not taken. But he cheat the people. He put it in the numbers. I have all the books for the magician people. When read the people his name of Allah, he swear of Allah subhanahu wa ta'ala, and then by numbers. And if he seen all the people shop put like 2 or 6 and number, I don't know what's the number. Yeah, it's not this one. Who said Bismillah ar-Rahim like this? It's from magician people, this one. Look this one. They became to me, he put in the neck. What call is neck? Can I read this one, brother, to him? Ya Hussein. He said, Ya Hussein, not Allah subhanahu wa ta'ala, he's put in the neck, and he said, I'm become okay after that. And some people give these people 16 copy from this one. He told him, put in the every corner of the house. He become okay. When I take in this one, open this one, not name of Allah subhanahu wa ta'ala, the same copy. All name Iblis, Fir'aun, Shaitan, okay, is Haman, not name of Allah subhanahu wa ta'ala. All these say, he said, this help you. And he don't open, and if he's scared, the man. And this all the ta'weed say, Ya Ali, Ya Ali, Ya Ali, Ya Ali, Ya Ali, Ya Ali. Not name of Allah subhanahu wa ta'ala. And all the ta'weed, this one, called Badduh. Badduh is the name of Shaitan. His Madad, Badduh, Madad. Ask the Badduh to help him, not Allah subhanahu wa ta'ala. And all the people live like this. Look, this one from the woman is from Indonesian. He's working the Saudi family, and he do black magic on him by money. He say like this, put something in the, this time before like this money from Indonesian. And this one, the same, not name of Allah subhanahu wa ta'ala, he can't from a name of Allah, all the Ali, 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 Ali. And look, another one. Yeah, inshallah, just. It's a lot, brother. I can't explain to the people, but don't believe anything. It's not right in the Islam to put anything in your neck. Not believe in this one. If you want to take the Quran, a pure Quran, don't believe anything like this. It's damaging your aqidah, and Allah will not expect not give the excuse because you understand. Alhamdulillah Rabbil Alameen.
If I believe that I am depressed, then what is my course of action? All right. And this is basically through many of the questions. What I want to say is this. What I want to say is that what we did at the beginning, in the first half of this presentation, is just to give some kind of context about the fact that to make sure everyone knows that these things exist and that there are some common symptoms for why this occurs. So first of all, what I want to say is that the majority of cases that we find, certainly myself, when I'm contacted by brothers and sisters who are suffering from some kind of problem, it always, always is the wrong word. Many of the times that when you look into the issue, it's all about context. And you heard that. So what I'm going to do, I'm going to reiterate or emphasize what you've just heard. It's all about context and what some people perceive to be a problem. As the doctor said, the issue of depression. If there was anyone who is going to be depressed on the face of this earth at the moment, it's the Muslims. Right? Because we are having a very rough time, nationally, internationally, from every angle. So if it was going to be just a case of grieving, then we have the most right to grieve. Yet at the same time, the one who understands Islam correctly, the one who understands the qadr of Allah subhanahu wa ta'ala correctly and has iman, then will recognize that most of these things are there to be understood in context, i.e. to be taken as part of qadr, as a test, as a fitna, as a trial, as a real affliction, as not an affliction. And you will see some examples in the Quran and Sunnah. It's very clear that sometimes people of the very highest caliber, like the Anbiya, are trialed. And it wouldn't make sense because you think, well, what about their iman? What about their aqid? It's perfect. So why such a distress? Why such a grieving? Such as for Ayyub alayhi salam, as Surah Yusuf so clearly explains, and other Anbiya. You'll find that a lot of people are not able to bring it down to a point of making people stronger, making people better, bringing their ideas forward and to become in control of the situation at hand. So therefore, what I want to say is that before you start to think that it's depression and be taken in by the community and by the society about what they understand to be depression, and if you keep getting told that you're depressed clinically, you'll start to believe it as well. And so people have to stop and step back and start to look at things, look at causes, look at the reality that they're facing. And most of the time, and this is from my own personal experience, because you don't have a qualification in curing depression, right? I certainly don't have a qualification in curing depression. But what I am qualified to do is to tell people what Allah subhanahu wa ta'ala tells them about their life, and what the Prophet sallallahu alaihi wasallam advises them about their life. And what you heard from the Shaykh is the first and foremost point of recourse. And that is that you need to look at yourself. You need to look at your actions. You need to look at the way that you are interacting, and those people around you are interacting with you. There's a question here. Why are the women mostly depressed? The women are mostly depressed because of what men put these women through. Why are South Asian women, Pakistani women, Bengali women of middle age such a large group, a focus group? Have you seen what these groups of women go through? Have you seen, how many of you know personally of either this age group of women in this country being abandoned, their husbands abandoning them, and going for younger women purely for their own selfish sex drives and desires, and going and leaving them hanging? And even worse, back home in their own countries where they get married and they come here and leave them. And what do you think that does to a woman? What do you think? Is this Islam? Is the way that you treat your woman, when you treat her like dirt, you treat her like a commodity, is that how Islam teaches the people to deal with their women? And then you have the other extreme. This is obviously what? An ignorance, right? This is a lack of knowledge, as the Shaykh alluded to. This is a different type of ignorance, because we have an ignorance where everyone is blaming something else and then going to these faith healers and whatever they are and getting all these wacky cures which they have no idea about, which can often go all the way to kufr and shirk. This is the scary part, right? And you find that the way that these things are protected is incredible. I remember a couple of years back going to Pakistan and finding a relative having one of these ta'weed, and it took me half an hour just to open it. And I didn't realize, why is this so secured? It's leathered and bound and sewn and double stitched and everything. By the time I was able to open it, I looked inside, numbers, crosses, numbers, crosses. Absolutely nothing. When I showed it to them, they couldn't believe it. The people can't believe it. So you have some forms of utter ignorance. But then there's the other ignorance of people's actions and desires not being in concordance with Islam. And then you have another form of ignorance, which is that of the religious extremists. Those people who think that it is piety, or from part of piety, to make the women stay at home and do nothing else and have no contact with anyone else. This is where they are, this is where they should be. And they put their women, their practicing women, and themselves practicing, quote unquote, through such a psychological trauma by what they make them not have any company and not have any life. Whereas that person themselves, they would have to go out and speak to their friends all the time, and go out to dinner and have functions and go to circles and study and meet up with the community. Whereas the woman, well, she's not allowed to go out, she has to look after the kids, she has to cook, there's no life. What do you think that does? So often people will immediately come with a problem and they're not looking at the surrounding factors. And in most cases, it is due to a non-practicing of that gift that which they've been given, which is guaranteed to cure the big problem of ignorance, and that's knowledge, the knowledge of Islam. So what I want to say is this, is that before you start to then go to put depression to its furthest possible point, you need to start at the beginning, look at yourself, look at your context, start to understand and educate yourself, and then only then do we then start to see whether this is a medical problem indeed, clearly, conventional, that needs to be then addressed by the doctor, or alternatively, look at taking a ruqya form from someone who is authentic and trustworthy. And then if it goes further onto the issue of jinn, then the specifics that are and will be explained by Sheikh Talib will then come into force. This is the most important precursor for the brothers and sisters to understand. Don't make everything into a huge problem. At the same time, the community needs to recognize that we are actually part of this problem. We are causing, through our ignorance and not accepting of the fact that people are having problems and just writing it off, we are causing that to become worse. As in everything, it's a balance based upon knowledge. What is waswasa? Is it something from the shaitan, or is it a chronic personal condition?
Bismillah, alhamdulillah, wassalatu wassalamu ala rasulillah. The waswasa is Allah subhanahu wa ta'ala said in the Quran. It's different waswasa that you think now. The waswasa is the shaitan come to your brain, he told you do some bad things. This waswasa from the shaitan. But some people like waswasa now is heaven in the brain all the time. He think like about that, touch maybe the water. Maybe some people like make wudu 3 times, 4 times. This is different. It's not from the shaitan. This is endless problems. And some people, when you open the door, you want to clean the handle. And this one not from the waswasa from the shaitan. This is the problem in the brain. The psychology, the problems. Yes.
Just to add in there, what the Sheikh is talking about is something that psychiatrists call obsessional compulsive disorder, obsessional cleaning rituals that you think you're dirty, therefore you have to wash your hand not just once or twice, sometimes 10, 15, 20 times, or you have to clean the whole house, or you're worried about germs coming into the house, things like that. There's an actual illness which is well understood and well defined, which I think the Sheikh is trying to describe, and it's different from what waswasa is, I believe.
Okay, the next question is covering 3 or 4. Someone has obviously misunderstood and said, you, Sheikh Talib, said that a man had ta'weedh and invoking Ali, but said he became better. How is that? Of course, Sheikh didn't say that, but he'll explain that in the answer an important point. And that comes up with a few questions. That what about those people who are wearing ta'weedh and they get better? What about those people who are finding relief in those obviously non-Islamic cures?
Yeah, sometimes he become better because the jinn help the people to make shirk of Allah subhanahu wa ta'ala. Most people taking the ta'weedh, he say, he has no problems, or has a problem. He have no problems, he put the ta'weedh, he thinks he's okay now. But nothing happened, no change. How can this ta'weedh help him if he has the problems? How can this ta'weedh take the jinn from him, he have the jinn inside? But his weak iman, he won't hang from anything. He won't believe. The ulama saying, every people in the world, you have to put like worship to some things. If not Allah, to worship any other things. This heart you have to fill inside. Not to live. Nobody say no godless is wrong. Anyone say godless is lying. He worships some things, but something the good or something the bad. And the people use the ta'weedh. He say I'm become better. Subhanallah. How can you become better if you have nothing wrong for you?
Just to follow on from that point, it's well known that certain people's certain personalities are more suggestible than others. If you go to someone with a strong belief that they are going to cure you, yeah, and you've traveled a long way and you've put a lot of time, effort, and indeed money into that, you are already halfway there. And we already know that in conventional medicine, if you give people sugar pills and tell them they are actually taking strong medication, which will make them better, regardless of what illness they've got, certainly for depression, about 15-20% will get better anyway, even though they're taking no active medication, which is what we call the placebo effect. So people, if they believe they're going to get better, sometimes will anyway, and they will then attribute the fact they got better to the medication or the ta'weez, other things, even though there is no power or medication in it. In real terms.
The next group of questions are concerning the wearing of the ta'weedh. Is it permissible to wear Quranic verses around the neck? Likewise, is it okay to put Ayatul Kursi around the neck?
All the ulama, he said that it's not allowed, Quran or non-Quran, to put your neck. They close this way. Because the people using all the people like the bad things. The ulama, he's called Babu Saddu Dhara'i', is not allowed to use the Quran because the people mix the Quran. If you put the Quran in your neck, why? The Prophet ﷺ, you have to read the Quran. Read Ayatul Kursi in the morning and evening when you go to the bed. That's enough. If you put your neck, you go to the toilet, sometimes join your wife, it is not respect the Quran. If you want to put your neck, it is not Quran, it is not help you like this. Quran, if you're reading, it is help you, not your neck and your arm.
Just to clarify what the Sheikh is saying there is that the the scholars, even though there's a few who said that it is permissible when it's only the Quran, but a principle is invoked by the majority of the scholars called Sadd al-Dhura'a, which is called blocking the means. And why do we invoke this principle? Why have the scholars traditionally invoked this principle? Because when the scholars perceive the community to be at risk of something, then they totally close the door to that problem. So even though something might be permissible, then we put it in with the impermissible to make sure that no one goes there. And the reality is that if you just think about it from a common sense point of view, if you were to count up the amount of ta'weezes in the world and said 1 million, you'll find that only very few are actually of Quranic. But once you allow the people to make it purely Quranic, as some scholars allowed to do on good basis, then you give a green light for all of them, and then this gives these charlatans and these magicians and all these people who are causing such a problem license to just go ahead and do that. That's what the Shaykh is explaining in his principle of Sadd al-Dhura'a. The key question, I suppose, what are the symptoms specifically of jinn possession, and how can one say that this is not mental illness?
I think I told you before about if you have the people, the jinn, you have become, when you read the Quran on him, he has epilepsy. If the epilepsy coming is not water come the mouth, not the eyes become white, not hand move like this, he has the jinn inside. But is it very difficult the people explain, because you have to see in the people. If anyone he said have the jinn inside, is wrong. Nobody believes that they say like this. But when you read the Quran, the people, you explain that people have the jinn inside or mental problem. Very difficult, the people, they found it. And just the brother is the last question. Last week I saw the big man, old man, is he robbed the toe, like tied by black material like this. And he has diabetic problems. I said it's not good for you, because maybe it's become like gargantuan problems. The blood not cycles. Why use a black material? Why no white? The people he's using the black all the time. Look, all the time black. Why? Because he's the shaitan and the jinn. He like black things. And you need the da'wah for the people, not like push to take him out from him. You have to speak very, very, very soft.
Does that apply to Thiyab as well? Just to clarify again, what the Shaykh is trying to say is that a lot of people, I must add a very important point here. The Shaykh actually insisted on giving this dars in Arabic because that's what he wanted to do, but I decided that it would get lost in translation. That's basically what the solution was, and it would become too fractured. So that's why the Shaykh is struggling to express it in English, and we're grateful for that. But I'll clarify at each point what he's trying to say. The Shaykh is trying to make the point that a lot of people go quite quickly to the jinn explanation, but in actual fact, he gets to see through his thousands actually per year, very, very few cases of jinn. It's a personal perception that they have been afflicted by jinn. And very rarely would it be the case that a person would say, I have been afflicted by the jinn. And the Shaykh is trying to say that, in the comparison to the epilepsy, that most of the time it is a case of an epileptic that's developing epilepsy, and it becomes clearer upon his questioning and investigation. And the Shaykh said that maybe in a year he might have seen 3 or 4 cases of actual real jinn. So when you can understand that as a percentage. And like I also want you to know that this group of questions are for Shaykh to answer, and then the doctor to then add clarification. That's the reason why we have 2 experts of the unconventional and conventional, as it might be referred to. The question here is, what is the exact difference between the eye, al-ayn, and black magic and the jinn?
Al-ayn called evil eyes. The people like some things. The Prophet ﷺ one time, the Sahaba he tried to take out the clothes, and the Sahaba, he seen some people, he say the skin is no like spot, and suddenly he fell down. And they take him to Muhammad ﷺ, and he makes a story what's happened. And the Prophet ﷺ said, why you kill your brother? If you seen anything like it, beautiful car, houses, you have to say, Tabarak al-Rahman. If you say Tabarak al-Rahman, okay, before like open eyes, okay, is Allah protection this one. Okay, after that the Prophet ﷺ asked him to make wudu to the companion and put the wudu in the back, and he's back normal. This evil eyes, the people jealous inside, and not in eyes, the problem in the heart. The eyes just like mirror. The problem comes in the heart, because if you bring the people like blind people, he do evil eyes to you, no problems, because when you explain to him, you have the all nice car outside. This coming in not eyes, in the heart, and he's the problem in the heart, not in the eyes. And this one evil eyes, some people like jealous, and send the evil eyes by to kill something or to destroy something. And this evil eyes. The black magic is the people go to the magician people to ask him to destroy some people. And the black magic is 5 kind, not 1 kind. One by water, one by air, one by fire, and 4th one by underground, but underground. The 5th one send the jinn to possess the people. This is a black magic. And what's the 3rd one?
كيف تختلف يعني بين الجن والمجنون يعني
when between the people mad and between people like black magic is different. You have to explain, read the Quran on him, and after that he feels something inside. If not feel anything inside, he has another problems. The people who has a problem, black magic or evil eyes or the jinn inside, when you read the Quran on him, is affect on him, the Quran, and he's make mad or something. But if it's no change, he has no problems. But he can't explain the people. Maybe some people has black magic, you feel like headache, you feel crush in the chest, you feel numbness in the body without reason, you feel sometimes all the time gloomy. It is different. You have to ask a different case.
The difficulty here, of course, is to try and specify something which is so detailed. But then another questioner asks, what are the things that we can do from the Quran and the Sunnah to actually repel black magic, or do we need to seek someone who knows? What are the specific ayat and the specific actions? What about the water that is drunken and that is blessed? How does one do that? What is the basis for that?
The Muslim, the Prophet ﷺ saying, you have to read the dua morning and evening, and the dua before sleeping. This is protection to you all the day. But if the people has black magic, you have to find the people make ruqya on him, or he try to make ruqya by himself. Okay, if there is still problems, you found another people to help him. Using the water to make ghusl and the drink, this help him inshallah quickly.
So could you advise which surahs from the Quran?
The surah is many surah in the Quran. If you have the problem black, happened black or before, is black done or no?
No, after black.
After, yes.
After it's been done.
Yes, if you have you have to read some ayat from the Quran, the ayat al-Fatiha, 5 surah ayat from the Al-Baqarah, ayat al-Kursi, the ayat in the black magic is from Surah Al-Baqarah 70 and 92, and go to the last 2 ayat from the Al-Baqarah. I had to explain to you because all day, if you want, I give all the ayat. It's like maybe 15, 20 ayahs. Very difficult to explain to you, but if the people you want it, I give him inshallah.
The Sheikh has authored some books on this in Arabic and detailed it there. I'll put that up inshallah on the website soon. Could you please tell me whether it is permissible to write the number 786 instead of Bismillah, because a lot of Asian brothers and sisters do. There is even a nasheed banned by that name.
Yeah, I told the number is haram to using. The numbers, all the numbers is haram. All the numbers is not name of Allah subhanahu wa ta'ala. All the magician people using the numbers, you won't cheat the people.
For both of the Sheikh and the doctor, how do you differentiate true schizophrenia from jinn possession? Does our psychiatrist feel that many of these patients are in fact possessed by jinn?
I think this comes back to what the Sheikh said a few minutes ago, that he's an expert in this area and I'm not. In the many cases that he sees, and they number in their thousands, he only sees 3 or 4 cases of true jinn possession a year. And as a psychiatrist, I see a lot more than that in terms of cases of schizophrenia. So you can tell by that answer that the majority of cases that we see, I certainly do not feel fit anywhere near the description given by the Sheikh in terms of jinn possession, because they don't have the symptoms that he's just mentioned, really. So when we talk about true schizophrenia, I mean, schizophrenia is schizophrenia. I'm not sure whether there's a false type of schizophrenia or not, but I mean, I guess we'd say schizophrenia is one on the one hand and jinn possession on the other. But the vast majority of cases I would see more in a Western, or if you want to call it, a more traditional context of mental illness rather than jinn possession.
Yeah, and this is old disease, not a new. This is old disease, and this word is not English; it's Latini name.
A year ago, I had a ruqya done, and my body shook violently for hours. And no, I'm assuming I said screamed. I screamed like a mad woman or animal. And my body shook violently for hours, and I screamed. I'll have to guess, like a mad woman animal. I have severe depression, insomnia, and over the past year I have performed Hajj and become closer to Allah subhanahu wa ta'ala. And I've had many ruqyas done, but I have not recovered fully. And these have been performed according to the Sunnah and the Sharia. I have also performed ruqyas on myself. My progress has been slow and steady, but I still have burning pain, nightmares, depression, insomnia. Maybe it is a test from Allah subhanahu wa ta'ala. Please advise.
I think you advise her. I think it's, the sister of the mom. The problems is she has depression problems, and especially when they feel like in the heat in the feet. It's a problem not from the jinn or from like outside. If he has some problem, the problem inside the body is hormones problem and genetics problems, and the move, and she feel pain every time in the move, and this area, this psychology problems. If it's still problems, you have to make ruqya by herself, and you have to change the routine for the life. If you don't change the routine, maybe it's still a problem for her.
What the Sheikh is basically saying there is that when these kind of symptoms, very clear physical internal symptoms, are in conjunction with the feeling of depression, then it's clear that it's not something from the jinn, and it needs to be treated as an illness in a conventional way, as well as changing as the Sheikh advised from his experience, the environment and one's context. I will add actually that although you might feel that some of these statements are quite blunt, the fact of the matter is that there's no kind of Hogwarts school for treating people who are majnoon, right? Just being seasonal there. This is something which is pure experience, right? Yes, a firm grounding in Sharia, and the advice of the scholars, and then seeing a vast amount of people, and then being able then to be in a position where you are, and anecdotally speaking and experience speaking, is the most valuable thing here when it comes to the field that the Sheikh is working in. And that's why sometimes a person will come, we've known this from the Sheikh, that he will look at a person. I mean, I'll give it to be easier. I'll give you my explanation or my example. A person will come to me, and I will converse with them, and maybe half of them I will get them to change their mindset and think about things. Just a reminder. وَذَكِّرْ فَإِنَّ ذِكْرَى تَنْفَعُ الْمُؤْمِنِينَ. Remind, because a reminder benefits the believer. And sometimes you just need that. They need to be told to rearrange their life and get their priorities back in shape and focus on Allah, not on the dunya, and so on and so on. Half the time it works. The next half, then what happens is I look at it from my own personal medicinal background, and I was thinking this is either a medicinal thing, and then I will either send to a doctor, or if I am unsure, then I will always refer them to Sheikh Talib. And what happened with Sheikh Talib is that they will either go and see him, and Sheikh Talib will with them maybe for 30 seconds or a minute, and he will then either send them away, or he will continue and give ruqya or treat for jinn. That's the system, because the Sheikh knows straight away and can feel it. It's something from experience. It's very difficult to explain, right? To try and give, like, this has to be there, this has to be there. Just look at a person and say, you know what? you don't have anything to do with jinn or black magic or al-ain, you have a medical problem, you need to now, indeed, as Dr. Amin said, do the dini part, but you need to now start to involve the conventional as well. You touched on many important issues, however, you didn't cover the issue of anxiety in terms of a stress-related illness. Many youngsters suffer from anxiety disorder, and medicine does little to help. What is Islamic cure for clinical anxiety and depression and OCD, which are all forms of stress?
Well, I'm not sure I'm qualified to give the Islamic cure for all these conditions, but it's true that stress is a very general term, and we all suffer from stress in all sorts of areas of our lives. And stress in itself, is important to remember, isn't necessarily by itself a bad thing, because we all need a certain amount of stress in order to function effectively. So all those of you who, I'm sure many of you, will have sat exams of one sort or another, the actual anxiety of the exam makes us want to revise, because there is a fear of failure, a fear of not getting to the university, college, etc. So a certain amount of stress is quite positive, because it makes us do things and makes us actually, and motivates us. Obviously, too much stress can actually work the other way. It can make us kind of very anxious, therefore we're not able to concentrate or revise or sleep, etc. So it can be bad for us from that perspective. Now, stress is a general term which can cause a variety of different mental symptoms. Now, anxiety, depression, etc. are all in that category. But as I mentioned before, there is a difference between feeling anxious as a result of the fact that, you didn't get into the university, or you failed your exam, or you just become divorced. There's a difference between that kind of anxiety and depression and what we call a depressive illness, which affects all of the body and doesn't just affect your feelings, as it were, can affect your appetite and weight and all the other things I mentioned before as well. So I'm not sure, I'm going to hand it over to the Sheikh for the Islamic cure, but from a kind of psychiatric perspective, the actual treatment will not necessarily be, well, you need to see a psychiatrist and need to get on medication. It will be understanding what is the source of the stress in the first place and trying to alleviate that. And a lot of what we do, from my perspective, sometimes is tell people actually what you don't need actually is medication, and what you don't need is therapy. What you need to do is you need to change your job, or you need to actually improve your marital relationship, or you need to move house, or whatever it is causing the stress, because without that, it doesn't really matter what therapy or medication people give you. It's not going to solve the problem.
I'll add 2 points to that. Number one, something which we've mentioned before, really in a correct and pure understanding of Islam is enough to calm people down, to make people understand what is happening to them in a way which they recognize that it is actually part of normality. And as the doctor said, sometimes it's what we don't understand is what is normal, really. And I want to add an interesting second point is that I want to add is this, and this is something which the doctors might not know, but the pharmacists do, that the doctors who, and I won't say psychiatrists because I think they're pretty responsible when it comes to medication, but certainly a lot of doctors are very irresponsible when it comes to medication. And antidepressive medication is so on the rise, and if I was to look in my pharmacy, I can, it takes up a huge chunk of my back wall, and I can tell you that a lot of people I will have seen in the shop that would have come to me and said that I want something like this, I'm feeling down, is there any herbal kind of remedies, whatever. And maybe a week later they'll come back with a prescription, they've already been to doctor, and immediately doctors put them on without referral, without having an opportunity to get them referred to someone to speak to them, whatever, straight onto serious antidepressive medication, which they by themselves cause so many symptoms that in any normal context could be seen as depressive symptoms. And then trying to come off these medications is hard work in itself and causes a whole host of problems. At the same time, again, to pick up what Dr. Shazad said, a lot of the time it's about convincing the person that you don't really need to take medication and resort to it. And the proof of that is this. There are people who go, and the doctor only believes what the patient tells them, right? You write the prescription, this is go and take these pills. And I can tell you that the amount of complete packets that I take back from patients who have not touched a single pill and go back and the doctor believes that the pill worked, right? And the patient believes. But somewhere along the line, they get home, they open up the PIL, the leaflet, and they read all the things that's going to happen to them when they're going to take this medication. They suddenly realize they're not depressed anymore. They look at the headache, well, okay. They look at the stomach ache, look, okay. Lose sexual appetite, lose this, have that, whatever, and impotence comes in. Then when they start to see real serious things that are going to affect their lifestyle, it's not such a big problem after all. So what this is a proof of is what the doctor again said, placebo, mind over matter, and the fact that we have that power. That's not to negate the fact that medication doesn't work and that there are conditions to know. But what's very important to realize is that Islam, one's iman, one's just general outlook on life and control. Because there's a question here that asks, that says that you said, referring to Dr. Amin, that those of a lower social class seem to have a greater problem with depression than the upper kind of classes. But in actual fact, the questioner says that there are plenty of that existing amongst upper social classes as well. So it should explain that if this was correct as a theory, there should be no depression in the most well-educated and so on. But we know that's not true, because it's not just an issue of class, it's an issue of control. And some of those who are upper class, whatever, they are the most disturbed people. I mean, look at the rulers of the world. There's a proof in itself. I suffer from anxiety. Sometimes it's so bad I feel like I can't do anything normal. I do have a firm belief in Allah and I pray, but I still suffer. What can I do to keep me calm and help me find peace?
You have to carry on your life normal and you change your routine, I told you before. This problem happen is like a long time or like just a few times sometimes, because if you long time you have to see the doctor. If you sometimes come to you have to change your life routine and you change like anything. Don't say the same routine every day. Morning wake up like this, and don't sit alone. When you sit alone, the whispering come to you. You have to join with other people. And this advice, and carry on the remember of Allah subhanahu wa ta'ala, read the Quran, listen the lectures. This help you, inshallah.
Yes, obviously, in addition to zikr reading the Quran, that has in itself a shifa and a calming effect, as does salah indeed. But in terms of other things you can do, I think one of the key things to say is where does the anxiety come from? As the Sheikh mentioned, if the anxiety is specific to a certain situation, so for example, if you hate your job and you get very anxious first thing in the morning when you get up and you think, oh my God, I've got to go to work, then clearly there is a particular problem there you need to address. However, if the anxiety is independent of any particular factor, personal, family stress, then you may need to kind of, and as Sheikh said, if it's been going for a long time, you may need to look at some specific treatments for it. Now, obviously there are medications available, but for anxiety there are lots of things you can do not medication related. So there are techniques you can learn to help to relax your muscles, specifically control your breathing. It's quite interesting that if you can control your breathing and breathe quite slowly, you cannot become anxious. You cannot be in an anxious state and be breathing slowly and deeply at the same time. And there are other non-medication techniques as well. So there are things that you can benefit from by seeing your GP or seeing your counsellor.
Sheikh Talib, according to medical science, there's a type of epilepsy which you described as being by the jinn, i.e. staring ahead, and that's called absent seizures. And there's treatment available in the form of drugs, i.e. it's not by jinn. So can you comment on that? Because قال الوصف أنت وصفت هي نوع من الإبليبسي كذلك.
يصل ما وصفته
أي
يبقى العلاج طبيعي.
The Sheikh said that if that is the case, a person who is indeed looking like that or is suffering from absent seizures, then let him get medical treatment. And that fits with the point that we're trying to say, is that it's not always as romantic and exciting as we might like to think.
Not from the jinn.
Yeah, this is clear. What the Sheikh is trying to say is that to the untrained eye, you might confuse, but to the trained eye, epilepsy and jinn are like chalk and cheese. It's very easy to differentiate. That's what the Sheikh is trying to say. Is there any evidence that ruqya will work on a Muslim jinn? Yani get rid of a Muslim jinn? And if so, what is the proof? I suppose the first question is it possible for a Muslim jinn to possess someone? And secondly, what is the proof that ruqya will work on them?
Yes, like Muslim human, you do bad for a human. What's the problem? The same. Yes, there's some human kill a human, and the jinn the same. It's no different. The same, because they are a nation, other nation. Okay, they are do some bad for another people. He like it. He like married, his children the same, and eating and sleeping the same human. If you make like Muslim, the same Muslim like make a problem for the human, the same jinn. It's normal.
But we never did anything to them. Why are they picking on us for?
Sometimes he love the person. Yes. Why the Prophet ﷺ saying when you take your clothes off, you have to say Bismillah. If you say Bismillah, the jinn you can't see you. But if you take clothes, okay, and don't say Bismillah, the jinn see you. Sometimes like the body, you go inside. Yes. And most of the problems and the people fell down in that bath and toilet. When you go to take the bath and toilet, no say Bismillah, because this is the place of the jinn. Many cases fell down in the toilet and they kill the jinn. Sometimes they go revenge inside the body. You have to say Bismillah.
And so what's the evidence that ruqya will work on the jinn? الدلائل من السنة.
The Prophet ﷺ saying when there happened the black magic on Muhammad ﷺ, and the Jibreel, Mikael came to Muhammad ﷺ, and he sitting in the head, and he talking to each other, and the Prophet ﷺ listened to him and make ruqya of Muhammad ﷺ. And this is from the Quran and from the Sunnah. The Prophet ﷺ, many dua, many hadith like this. Bismillah, Allah yashfik, wal Quran yashfik. The hadith has many hadith like this.
If one is to be possessed and it is going to be by the jinn, then what about the possession of the demonic nature, yani shayateen, like in Christianity, where the demons are expelled via the invocation of the Father, the Son, and the Holy Ghost? And how comes it works for them? And are they possessed by jinn, or is it something else that they are possessed by?
No different between Muslim and Kafir. No different. No different. All the same. The heaven, if they're kuffar and Muslim, the same. The jinn make a problem for anyone. He like it. He make like sometimes like make revenge, kill sometimes from the family. Why the Prophet ﷺ saying if you want like after Maghrib, the Prophet ﷺ say keep children at home, don't leave them up because the jinn distribution now. Any problem happen, the kids outside, okay, maybe the jinn come inside him. For the kuffar or non-kuffar or Muslim, the same. No different. No different.
I.e. what they used to know, what they used to refer to as demon exorcism and so on, is very possible for it to be a jinn. And again, re-emphasizing the point that it's just a basic application of the Sunnah of the Prophet ﷺ that allows one to be protected. Because I know everyone here, it's clear from the questions, they want to know specific ways. It's just one part of our nature, isn't it? Specific things that we can do to protect and so on. And maybe it's disappointing when you're not told specific answers, because the answer is a general application of the Sunnah day and night, and that we have been instructed, provides for that cover, provides for that safety, unless it is, of course, the qadr of Allah. When within my work, I come into contact with people who hear voices. Is this the voices of jinn instructing them to do wrong? What is the Islamic perspective on this when you hear voices? This is for both.
Yeah, this mental problem, this situation, mental problem, not from the jinn. This mental problem, he has a problem in the brain. The brain come damaged by maybe genetics problems or like by drugs. The doctor explained to you.
Thank you. The first thing is, what do you mean by hearing voices? Now, obviously, in the field I work in, I see a lot of people who describe hearing voices, and not everyone describes hearing voices in the same way. What some people describe as voices are actually their own thoughts spoken out loud. You know, some people think out loud, and they think of things to do, and in a sense it's themselves talking about what to do or what course of action to take. So there's that group. In some cases, hearing voices actually isn't a sign of illness. So, for example, hearing things when you are going to sleep, around that time when you're beginning to go to sleep, or you're beginning to wake up, that is not seen as being significant in terms of defining any illness. One of the previous questions talked about hearing voices of people who've passed away, so hearing voices of your relatives. Certainly, in the aftermath of losing someone dying in your family or someone close to you, hearing their voice as if I'm talking to you in that context isn't part of an illness. It's part of what we would see as normally grieving for that person. Even seeing them sometimes, seeing their face or seeing someone in a crowd and thinking it's them or mistaking somebody else, that's sort of, hallucinating visually as well as kind of hearing things. Even that isn't seen to be particularly significant in that context. The context is important. Obviously, outside of those things, if people are hearing clear-cut voices or, hearing people talking about them, for example, things like that, then it is likely that they do have some form of mental illness. But even then, you need to look at the causes of that. So, for example, certain types of drugs, stimulant drugs and other drugs can cause you to hallucinate. And obviously, if you stop taking the drug, you stop hallucinating. It's one of the side effects or symptoms of drug taking as well. So there are lots of different causes of hearing voices, and not all of them signify kind of, schizophrenia or chronic mental illness.
And I think that this disease is called like schizophrenia problems. I think a two-person, the one body. This might explain to me the people when they hear voice, and sometimes the people is try to kill another, try to kill himself, try to kill another people. The voice come in him because I think is high type. This one about two-person in one body. This problem. No.
Just as you noticed there, you might have noticed that when the question was put to the Sheikh, very, very quickly is mental illness, and that's again something which is a experience issue. I want you to to focus on that point. Naam, Sheikh. Barakallahu feek.
Just add something to the previous, we have to fear Allah subhanahu wa ta'ala, not the shaitan or jinn. If we fear them, they attack us. Hearing the voices is the qareen, the people, the dead people. The qareen, he comes in the form and the voice of the dead person, and he take his form and voice. He speaks to that person.
He's saying about the qareen make whispering the people in the voices is not from the qareen. The qareen is make like waswas for to do some things, not by order to you to do. Some people try to kill himself, try to kill another, is not from the qareen. Because if he says from the qareen, the shaitan control to you. Allah subhanahu wa ta'ala not ask you in the last day. If you say like this, some people like do bad things, he say like qareen, he told me I have the black magic, I have some things. But the qareen is different. The qareen, he make waswas. He told you, try to do something. Do. But not like you to do by himself. Not forced you to do. Just make waswas to you. Not take the gun, take the knife to kill the people. No, he told you, try and waswas. But it make order to you to do. This between qareen make waswas, only waswas. Allah said in the Quran, الَّذِي وَسْوَسُ فِي صُدُورِ النَّاسِ. Just waswas. Not like
Schizophrenia,
yes, it's different.
Yeah, what the Sheikh is wanting to say is make a clear distinction. One of the clear defining factors between schizophrenia and a person who has been afflicted by jinn or by the qareen, which, as you know, is someone that associates with us at all time and accompanies us at all times, is that their implicit suggestions in the form of whisperings are only to suggest, whereas the actual action of someone doing something serious, criminal or whatever, is a clear symptom that defines schizophrenia from jinn possession. That's a fa'idah from his experience that he has seen. There is talk amongst the medical community of a phenomenon known as PMT, post-menstrual tension, which can entail depression and frustration for a woman. What is the Islamic point of view on PMT? Does it exist or is it a deception of shaitan?
I think the question is referring to premenstrual tension, not post-menstrual tension.
Actually, it does say post, and I was obviously asleep when I'm viewing it.
Well, I'm not sure about postmenstrual tension. I've never heard of that before. But premenstrual tension is the mental and emotional changes that can occur before a woman has a period. Obviously, it's related to some of the hormonal changes that are happening around that time. It's been the subject of great controversy over the years, whether it's actually a kind of hard medical illness or not, whether it's just part of a natural cycle that a woman obviously goes through and emotional changes related to that. So it's difficult to say yes or no, it is definitely a condition. Certainly, if you talk to the pharmaceutical industry, they would like you to think it is, because they obviously want a market for their products. So they sometimes create conditions, that they've got drugs to cure. And certainly some of the antidepressants have been marketed to cure and treat premenstrual tension. However, there are other treatments for this as well, including vitamins and various other hormones, etc., etc. So this is not a clear area at all, really, and my experience of it has been that it is very difficult to define, and every woman gets it, different degrees of it, and people cope with it in different ways. I wouldn't put it in the same realm as mental illness particularly, but there are some treatments you can try, vitamins, different things which may help, but I don't think it's clear-cut mental illness.
Sheikh Talib Aqari gives out ta'weed, and he says that they are all from the Quran. Is it haram then? What the Sheikh is trying to say, and again to clarify this point, is that there is a majority of scholars that do not allow this, all right? Even though there are a few from the early scholars that did purely. But the point is that the principle of Sadd al-Dhara'i is applied to minimize the risk and to make sure and weed out the charlatans that are misusing this. Schizophrenia, is it jinnat or mental illness? We've done that. That how... what can I do when paraphrasing this question that comes about a person who had a person who was afflicted by a jinn or thought so and went to a faith healer who then persecuted her in that her ribs were crushed and it was all, and she was killed in the name of jinn possession. And this is still not awakened our people up to this reality, who still rely on these people and on peers and on ta'weed. What can one do about that? Which is linked to the next question: how does one train to be a healer like yourself, and the correct way to do it? Which is linked to another question, which is why don't we professionalize the area of treating mental illness and exorcising jinn and doing ruqya, and to stop all these charlatans exploiting and making money and so on and so on.
The ruqya is, you have to follow, I told you before, the Quran and Sunnah. Is any ruqya without Quran and Sunnah, is it haram? You have to read the Quran for the people illness, and read the hadith, and by Arabic language, not another language. This is important. And the ulama saying, if the ruqya like this, it is allowed. Anything mixed with another Quran is not understand like this. The ta'weed is nothing, is not right in anything. It's not Quran, this one, or nothing. The magician will understand. All of these people like numbers. He can't help the people like this. And some things like this is not Quran and not help the people. And you have to ask, avoid the people for three things. If you understand this people is bad or good. If anyone asks you your name and mom name, is magician people. Or some people ask you bring the clothes, or the people ask you bring the pictures. Three things, if anyone is not allowed to ask him. The Prophet is saying, if you ask this man, Allah will not accept your salat for 40 days. It's haram to ask these people. Three things: your name and mom name, your pictures, and your clothes. After that, you follow anyone, he's good people. And the important experience, brother. Don't follow the people who have no experience. The people who have experience, he say, every case you have the jinn, and no experience in the situation. If you put the jinn in your mind, all the time you have the jinn inside. But this is the problem. Make worse about you.
And to follow on from that, is it to go to an alim? Is it shirk if you go to an alim with the problem, and then he tells you to read Quranic verses to help you? And if he does not charge, is it still shirk even though you believe the help is from Allah, but you still need the alim to help you? Sheikh said, I've not understood. I said, also I haven't understood either. So, I just want to just clarify a point here. The money is not the issue here, right? Because if you're taking someone's time, an alim or a scholar or whatever, then the person who goes should have the good adab to compensate that. You would do exactly the same thing if you went anywhere else. So the issue is not in the money. It's the issue about the Hey, Rasul Sallallahu, this is something which is sanctioned. It's something, it's not the taking of a wage for healing, such as the one who does cupping and the one who does ruqya and so on. The very most famous hadith for the Shaykh will just add to this in a minute. The point that I'm trying to make is that a lot of people associate financial or the money changing hands with the problem here. That's not the case. The case is whether it's based upon Quran and Sunnah. The case is whether this guy is a charlatan or a joker or someone who is recognized and trusted in this community. And you can see in our community we have very, very few people in this country that we respect and trust like that. And this ultimately goes through a principle of trust.
The problem, the people, is not about the money. The people, if you bad people, he never told you you have nothing wrong for you. Why? Because if you told you are nothing wrong for you, he lose all customer. He want all the time follow him. This important. This important. The question, the people, all the time. Yeah, you have black magic, evil eyes, jinn, all problems. Okay, all the time come to him, and he no give you cure. All the time cheat you, and this is the problem. You have to follow the people. He give you right answer. What's the problem to me? Okay, check me if you have the problems. He say no. And the problem is weak iman. If you told him he has no problems, he don't believe you. He have to say he have something. This is the problem.
Talking about problems, we have a problem about trying to actually ask these questions or read them out, because unfortunately, due to our psyche and due to our makeup, everything mental is funny in the original sense, right? And of course that should not be. It's not right, I suppose, because some people are suffering these kind of problems. But so bear that in mind with these last few questions. My grandfather claims to be the Mahdi. He claims that he's been sent by God to change the world and teach people the Quran, which means that we must be the Mahdi as well. I know you said that reciting the Quran is a cure, but my grandfather reads it totally wrong. He claims that everyone in the world recites it the wrong way. He claims that everyone in the world recites it the wrong way, and he has been sent to correct everyone. For these same reasons, he is not allowed to go Saudi Arabia anymore. And out of respect for him, no one in the family is getting him any professional advice or even admitting that he has a problem. What do you think should be done?
You see how it's passed over quickly there to me. I think that gives you the answer, doesn't it, really? Well, where do you start, really? There are lots of people, seriously, there are lots of people out there, even for me in here, who have really quite strange ideas which I think even people in their own families and communities would see as being very odd, and would certainly fall into the realm of what I said before were delusions, clear false beliefs, and this appears to be one of them. Now, a lot of these people are quite happily living their lives and have jobs and families and friends and things, and are not really harming anyone. They have these odd beliefs and people kind of tolerate them. So the question of treatment only arises if the person actually is harming other people by his actions, or they are damaging their health in some way. On the brief information we're given, it's not clear as to what extent this man is actually interfering with other people or causing harm to himself or others. And that is the key question as to whether you need to get someone, treatment or help, even if they don't want it or not. clearly, if he felt he had special powers and was, feeling that he could go into the middle of the motorway and stop the traffic and things like that, then people would get arrested and treated fairly quickly. But if someone who quietly has rather bizarre and strange beliefs carries on with their lives, then clearly they can go for many, many years without needing treatment necessarily. So without knowing more about the case, it's difficult to say whether this person actually needs to be treated or not.
Okay, brothers and sisters, I think it's time for us to close, an appropriate time to finish, I think, on that last question. I think we should say Jazakallah to all of our three speakers, to Abu Isa, to Sheikh Talib, and to Dr. Amin, nearly to Dr. Chowdhury there, for coming and answering all of our questions. And I said, apologies to anyone if we didn't go through your questions, but obviously time was of the essence here. And to close, I would ask Abu Isa to close as well.
I want to just say a few very quick things. I have the Sheikh's contact details, and I know that many of you have asked that from me, and the Sheikh is going to be leaving. So I will tell you his phone number, so just get ready your pens or whatever that you can contact him by if you need to. But I urge you please to use this responsibly, and it's not just to be, bandied about, but only in case of need and so on. So the phone number is 07974 033 283. I repeat, 07974 033 283. There's also an email which would probably be less effective considering having to reply and so on, but it's al-arradajin@hotmail.com, which is spelled ALARADAHJIN @hotmail.com. That's al-arradajin@hotmail.com. I repeat, ALARDAHJIN @hotmail.com. If there are any other queries, then you can either pass them to myself or on the website or directly to the Sheikh. Inshallah. Barakallahu feek. I appreciate your time and understand that it was a bit difficult to get everything dealt with, but inshallah those who still have outstanding problems, and as always we're always still there to be contacted. Shukran. Wassalamu alaikum wa rahmatullah.